A 62-year-old woman, A, and a devout Jehovah's Witness, had hip and pelvic fusion surgery 20 years ago due to tuberculous arthritis. A month ago, she began experiencing pain again in the same area. She decided to undergo surgery to replace the fused joint with an artificial hip. But there was one major issue. Lady A firmly refused any blood transfusions due to her religious beliefs, and wanted the surgery performed using a bloodless technique. She consulted multiple doctors, but most of them refused, explaining that her condition made a bloodless surgery extremely risky. Finally, orthopedic surgeon Dr. B told her it might be possible to perform the surgery without a transfusion, but also warned that if heavy bleeding occurred, refusing blood could lead to death. Lady A understood the risks but insisted on her decision. She signed a consent form for surgery and submitted a liability waiver, clearly stating that she refused blood transfusions under any circumstances. On the day before the operation, anesthesiologist Dr. C met with Lady A and her daughter. He explained that massive bleeding could occur during the procedure, and that refusing transfusion could result in multiple organ failure and death. Just before surgery, Dr. C again confirmed her refusal. Lady A was unwavering. The surgery began smoothly, but because of extensive adhesions from the previous operation, a sudden massive bleeding and disseminated intravascular coagulation developed. At this point, a blood transfusion was the only medical intervention that could save her. Dr. B left the operating room and explained the situation to her family. Her children agreed to a transfusion, but her husband, also a Jehovah's Witness, firmly refused for religious reasons. The medical team urgently contacted the Jehovah's Witnesses Hospital Liaison Committee for guidance, but no response came in time. Meanwhile, the bleeding continued and A was transferred to the ICU. Eventually, her entire family including her husband agreed to a transfusion. But by then, her condition had deteriorated so severely that transfusion could have worsened her status. Finally, Lady A died from massive hemorrhage and pulmonary edema. Should Dr. B have ignored Lady A's and her family's wishes and performed a blood transfusion to save her life? Or was it right to respect her autonomy, even though the result was death?
In medicine, 4 key principles guide ethical decision-making, often called the 4 principles of biomedical ethics. 1. Respect for autonomy. Patients have the right to make their own decisions about their care, as long as it doesn't harm others. 2. Non-maleficence, do no harm. Physicians must avoid causing harm to patients. 3. Beneficence. Act in the patient's best interest and promote good. 4. Justice. Fair distribution of medical resources and equal treatment. These principles sound straightforward, but in real life, they often conflict. The most common clash occurs between autonomy and beneficence, as in this case. A patient may choose a course of action that could lead to serious harm or death. If autonomy is prioritized, the physician must respect the patient's decision, even if it leads to a poor outcome. If beneficence is prioritized, the physician may override the patient's decision to save their life. Traditionally, beneficence often took priority. Doctors believed they had a duty to act in the patient's best interest, sometimes even without the patient's consent. But this approach has a problem. It disregards the patient's fundamental right to decide, and physicians' judgments are not always perfectly objective or free from bias. On the other hand, absolute respect for autonomy can also be problematic. A patient's decision is often influenced by many factors like medical knowledge, trust in doctors, finances, religion, personal values, and fear. Religious beliefs, like those of Jehovah's Witnesses, can lead to life or death decisions, forcing doctors to confront agonizing ethical conflicts. Should doctors honor a patient's religious refusal of treatment, even when it leads to death? Or should they override that choice to save a life? Let's think more. If parents refuse to receive treatment of their minors for their religious belief, doctors should follow parents' decision or start treatment ignoring parents' decision? Parents generally have the right to make medical decisions on behalf of their children, but this right is not absolute. If a parental decision seriously endangers the child's life or health, the law may intervene and restrict that decision. In that way, healthcare professionals have legal grounds to provide life-saving treatment to minors in emergencies even without parental consent. If parents refuse essential treatment for religious reasons, doctors may lawfully proceed with the treatment to protect the child's life. Such situations may also be reported to Child Protection Services or the court as potential neglect or abuse. Which is more important between respect for autonomy and beneficence? Leave your thoughts in the comments.